And if you go out of the presentation, like it can happen sometime, you can just re-enter the website, type menti.com and then type the code, and you will be redirected to the presentation. So 2 minutes has passed. Yeah, and I'm seeing the likes, so you're here. And for those of you who can't be there with us in menti.com, you can just write your question in the messages, and I can see all your questions, or just say it out loud. Okay, so now we will start. Yeah, that's just a pic that I took from the AI because I like it and I put it there. And just for those who doesn't know me, I'm a 7th-year medical student in UISS. I'm deeply passionate about medicine and dedicated to helping others. Also, I have some several certificates and accomplishments. I'm a member in the Association Les Randonneurs, and I'm a former president of the Office of Sports and Arts and Associations in our university. And I've done some several certificates online, and I've been to some conferences. And I hope that all of this helped to shape my career. So are you ready to embark on a journey to explore a new case together? You can just type your answer so I can see it. And I'm excited for today's case. Just type whatever you want. There's no name in it. So that I can see that you're here. Yes. Yeah, me too. For those of you who can't type in Menti, you can just type here in the messages. I can see them too. Okay. That's good. So now we will start. I hope that it will be enjoyable for you too. And for those who just entered and want to join, they can just type menti.com and then the code to type too. Okay, let's start. So the objectives of today, we will have an overview of multiple sclerosis, and then we will be having a case presentation that will focus especially on the MRI aspect. And of course, to end, we will have a take-home message. So we'll begin with the overview. So for the multiple sclerosis, it is a relatively common acquired chronic demyelination disease involving the central nervous system. It is disseminated in space. It means that it has multiple lesions in different regions of the brain and also in time, because the lesions occur at different times. So it occurs between the age of 20 and 40 years old, and it affects the CNS in flare-ups. Flare-ups are les poussées. And it's an autoimmune reaction against myelin and viruses and environments. So we have some examples of common clinical features. So we can see in patients pyramidal syndrome, Brown-Sequard syndrome, muscular fatigue, cerebellar syndrome, and retrobulbar optic neuritis. Also, we can see diplopia in some patients. We can have paresthesia, posterior column syndrome, pyramid sign, and sphincter and sexual dysfunction. Also, they can have depression and asthenia. Also, it's important to note that this pathology worsen with physical effort and heat. So we can do some additional tests like brain and spinal MRI. And if needed, we can go with a CSF lumbar puncture. So it's cerebrospinal fluid, and we will find the oligoclonal bands in the cerebrospinal fluid. Now we will begin our case. So our patient is a 30 years old female. She suffers from localized hypoesthesia, hands and lower limbs, and visual disturbance. She did an ophthalmological examination and it was normal. Yeah, I'll give you some time to reread it. So now we'll go into the questions. After this one, we'll be having a question. So, what are the displayed MRI sequences? So, see the MRI and just guess what are the sequences that you see here to have the right answer to the next question. So here we can see different sequences. So I will give you a tip, like those four are one sequence, and this is another one, and this one is another one. So let's go to the question and response so that you can respond. Okay, so what are the displayed MRI sequences? Was it flare, diffusion, and T1? Was it T2 flare and ADC? Or flare, T2, and T1? Or flare, diffusion, and T2? That's good. So some of you just took the chance and answered. Yeah. Okay, so now we have 1 and 2 votes, and now 3 votes for flare, T2 and T1. Okay, and 1 vote for flare, diffusion, T1, and another 1 vote for flare, diffusion, and T2. So where is the right answer? And as I said, you can vote however you like. There is no, it's anonymous, so just be free. We are here to learn. Like, nobody is perfect. That's good. So I'm encouraging you guys to just vote as you want, as I told you, because it's supposed to be interactive, and I hope that we will just be having fun while learning new things. Okay, so now we will see the right answer. So it was flare, T2, and T1, and we will see why. So here is it, the image. Here you can see those are flare, and this one is T1, and this one is T2. T1 is usually like the anatomical section. T2 is the opposite of it. And the flare one, it's like the T2, but we eliminate the liquids in it. So yeah. I hope that this simple explanation was enough. So now we will go to the next one. Which site does not exist in the brain MRI? Is it especially in this pathology? So which site does not exist in brain MRI? Is it the juxtacortical supratentorial, paraventricular, basal ganglia? It is the noyau gris centraux, or infratentorial at the level of the left middle cerebral, peduncle, and cerebral hemisphere. So just think of the right answer, and it's okay if it's not the right one. Even if you choose the wrong one, you will learn better than someone who will not choose. That's good. Okay, so we have 2 answers. Okay. Okay. So does anyone want to vote too? Should I count to 5 and then we will see the answer? And as I said, it's better to vote than nothing, because at least if we choose something wrong, then we will remember the right one. So 5, 4, 3, 2, 1. And here is the right answer. So it is basal ganglia. It is noyaux centraux. So here you can see the image. Here we have the juxtacortical, and here is the paraventricular one, the cerebral hemisphere. Here are the lesions that we have, and one in the middle, cerebral peduncle. And just to note, so to differentiate between ischemic lesions and the multiple sclerosis, it is important to note that involvement of the basal ganglia is not typical in multiple sclerosis. So this distinction helps in differentiation between ischemic events and demyelinating diseases like multiple sclerosis. So usually in multiple sclerosis, the basal ganglia is intact, but if you have ischemia, you can find something in the basal ganglia. So they use it to differentiate between the two. And now, what sign is not shown by the brain MRI? What sign is not shown by the brain MRI? So is it lesions in high signal flare, lesions in marked low signal T1, lesions in high signal T1, or lesions in low signal flare? So we will go to the questions so you can answer. So those are the responses. So what sign is not shown by the brain? We have someone that really catch up really quick. Okay. Just try to guess. Like I said, you're not supposed to guess the right one in this one. I know it's a hard question, so that's okay. Like me too, I wouldn't have known this if I didn't read about it. Okay. So you can vote. Okay, just choose whatever you want. I see now that all of you just have chosen their legends in low signal flare. Okay. Does anybody else want to vote? That's good, at least someone who choose something else. Okay, now let's see the right answer. Okay, it's lesions in low signal flare. But that's okay, like, that's good. Most of you guessed it right. So here is the picture. So now you can see here the high signal flare, and here you can see the high signal flare also. Here is a high signal T2 and a low signal T1. So the only one that wasn't there is the lesions in low signal flare. Okay, let's continue. So here is the T1 C plus injected sequence. It shows enhancement of one of the lesions, which is in high signal flare. Enhancement, c'est le rehaussement. Okay, so this is a picture of axial flare, and this is a T1 C plus axial at the same level of cuts. So here you see the lesions, and now you can see the picture more clearly. I will go to the next one. So enhancement in the context of multiple sclerosis does not allow to confirm the character of spatial dissemination. It means multiple lesions in different regions of the brain. Or it doesn't allow to confirm the character of temporal dissemination. Lesions occur at different times. So which one? Like, why do we do the enhancements? Le rehaussement. Like, if you do it, will you see more lesions in the MRI, or will it help you differentiate between an old and a new lesion? So choose. I know the question is a little bit tricky, but just try to guess the answer. Like, it's okay. Nobody can see you here. It's between you and you. Okay. So you just have to choose between spatial dissemination or temporal dissemination. So we have 3 votes for the temporal one and 2 for the spatial one. Does anybody else want to vote? And of course, as I told you, you can, if you happen to go out of this game, you can just type menti.com and type the code, and then you will re-enter. Okay. So I'll count to 5, and then we'll see the answer. So anybody who wants to vote should vote now. 4, 5, 4, 3, 2, 1. Okay. Yeah, it was the spatial dissemination, because the question is enhancement in the context of multiple sclerosis does not allow to confirm the character of does not allow to confirm the character of spatial dissemination. Yeah, because enhancement, it helps with temporal one, not spatial, not the spatial one. Yeah. Now we'll go to the next. So an additional sequence was performed. What sequence is this? I don't know if any one of you know about this new sequence, but it's good. Like, we are just learning, so now you can type. If you know it, you can type. If you don't, you can just guess and type whatever you want. Just vote. So is it the flare with gadolinium chelates injection, or is it a late injected T1, or a double inversion recovery, or diffusion? Okay. Well, I know it's new sequence, but at least you get to see it, so that next time that you will see it, you will not be surprised. Mm-hmm. Okay. 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 So does anybody else want to vote? That's good. I'm proud of the 6 people who votes. Like, that's good. That means that you are learning something new today. Nice. So now let's see the answer. I will count down to 5. 5, 4, 3, 2, 1. And here we go. Yeah, it's the double inversion recovery. I told you it's a new sequence, so fusion one is not a new one. So here is it. The DER allows the suppression of the signal from normal white matter, thus increasing the contrast between normal white matter and the inflammatory lesions. So it helps eliminate all the white matter so that we can visualize the lesions more clearly. That's the point of doing the DIR. So what additional MRI should be performed? Is it the MRI of the cerebellopontine angles, or the spinal MRI, or the TMG MRI, or the brain MRI angiography? Choose your answer. Okay. خليف تعرف. That's good. So just votes. Like, it's okay. Mm-hmm. That's good. Okay, now let's see the answer. Okay, it was the spinal MRI. But that's okay, like, every guess is good as long as we are learning. So, this is the MRI that you wanted. So, the cervical. The cervical MRI shows 3 oval-shaped focal hyperintensities with blurred boundaries at the level of the cervical spinal cord, opposite C3, the C3 C4 vertebral disc, and in the region of C7. Like, as you can see here, and here, and also here. I made sure to write the C2, C3, C4, and C7 so that you can see where the legend is. I hope that you can see it. Okay, so now let's go to the next one. So we have here the summary of the case. So in summary, we have lesions of the juxtacortical white matter, both supratentorial and infratentorial and paraventricular, as well as at the level of the cervical spinal cord, spatial dissemination, including one that enhanced at the level of the left insula, temporal dissemination, primarily suggesting a demyelinating origin of white matter type multiple sclerosis. So in summary, it's multiple sclerosis. And in this case, we can see the importance of performing a brain MRI, especially if the patient experiences any visual disturbance. And here is our take-home message, and it's about the MRI in multiple sclerosis. So the MRI is pivotal in multiple sclerosis diagnosis and monitoring. Also, it confirms the diagnosis. We can confirm it by the McDonald criteria. I think the last McDonald criteria is was in 2017, the last one. Yeah, and of course the MRI helps us with follow-up and to with the follow-up to evaluate treatment response and determine the multiple sclerosis disease progression pattern. So all of these just help us to understand the importance of the MRI in multiple sclerosis. And as we conclude, I want to extend my heartfelt gratitude to two remarkable mentors who have greatly enriched this presentation with their wisdom and expertise, because I took those pictures from them. Also a lot of this presentation, because they are in radiology. Dr. Najas Qali Husseini, who is a pillar of knowledge and inspiration. And she is specialized in breast imaging. And also Dr. Asma Qali Husseini, who is specialized in traumatology and neurology. And of course, I took some of the information from Radiopedia so that it can be some valuable information for all of you. And of course, there is a forms, so I can hear from you. I can hear your feedback. I can see your feedback, not hear your feedback. I can see your feedback so that I can improve over time and bring better content, better presentations for you. And of course, I wanted to remember you of one thing, that discipline is the bridge between goals and accomplishments. It was said by Jim Rohn. And I think that's really important because motivation come and go, but discipline is what make us what make us accomplish and just work on our goals so that we can see them be real. And I'm really grateful for your attention. You've been awesome because you've stayed till the end, so I'm grateful. Thank you. I hope that you learned something new today.